Broadcast media can be an interesting and profitable dental marketing avenue.
But not all dentists are comfortable with radio or TV advertising.
Even when radio seems to be failing for some, we've continued our success, boasted one dentist.
It cheapens the profession, opined a California dentist. When was the last time you heard a cardiologist or a neurosurgeon advertise?
Hi, I'm Jim DeMolin, founder of thewealthydentist.com.
And I'm Julie Fry, managing editor. We conducted a survey that asked dentists about advertising on TV or radio.
And how many dentists are advertising on broadcast media?
In this survey, 41% of dentists reported that they are utilizing those dental marketing avenues.
I'm impressed. And how many are, how are their results?
Half of those advertising on TV or radio say they get excellent results.
And any other interesting results?
Yes. We found that dentists in rural areas are far more likely than their urban counterparts to advertise on radio and/or TV, presumably because they are drawing patients from a larger geographical area.
Makes sense. Also, it's less expensive in rural areas. Talk radio, it's the only way to go, declares one Southern Carolina dentist.
If I could afford broadcast media ads in Southern California, I really wouldn't need to use them anyway, moaned one dentist.
I do the I Hate CPAP campaign for sleep apnea patients. It works best if I do 2 weeks, then switch to another station. I'll return a month later, periodically do 1 week of ads, said an Illinois dentist. Continual repetition on the same channel seems to make you invisible.
I've heard good things about IHateCPAP.com and other dental websites.
If you're going to run ads on TV or radio, I think it's a fantastic idea to mention your own personal dental website. That way, prospective patients can get to know you more about you and your practice, and even request an appointment online. Now I'm going to tell you a story about the most successful radio marketing campaign I ever did.
All right, give it to us.
Actually, I was working with Dr. Michael Silverman in Philadelphia, Pennsylvania, and we've been testing sedation radio ads. And we got a call on a Tuesday afternoon from a radio marketer, and he said, you can get 2 ads, 30-second spots on the Howard Stern show tomorrow for just $500 each. And I said, $500 for a 30-second ad on Howard Stern? This is the radio. It was like the most expensive thing I've ever seen in advertising. And then Dr. Silverman went through and said, he went through all the demographics. They're just perfect for us. It's a large audience. And I have to tell you, we decided to go ahead and test it. It's easy to say that as a consultant when it's the doctor's money. So we ran the ad, and I have to tell you, we never got response like this ever in the history of anything we ever did in radio marketing. The phone would not stop ringing. It was just an outrageous success. The problem with it was it continued to ring and ring and ring and ring, because there's an organization out there that protests anything that Howard Stern does and attacks any advertiser that sponsors his program. This is one of the reasons he moved to cable eventually. And the issue was, I have to tell you, it was financially the best ROI we ever got, but we just couldn't take the harassment, the phone calls, and all the BS that came with it. So you have to be a little careful on these things. But truly, it was the best example of broadcast marketing I've ever seen.
Well, that's quite a story. If you'd like to learn more, visit thewealthydentist.com. Sign up for our newsletter, and you can cast your own vote in future surveys.